Good morning, everyone. We'll be starting the session in about a minute. Thanks for joining. So we're ready to start. Good morning. You can keep it, Arantxa, please. Thank you. Good morning and good afternoon to some of you. Thanks for joining us this morning. We are very pleased that you have making the time to be with us. We know that there is a lot of competing events, but the fact that you are here for this morning, for this hour event, we are very pleased that you have taken the time to join us to observe Suicide Prevention Day, which is tomorrow, October 10. My name is Claudina Cayetano. I work with the Pan American Health Organization as advisor on mental health. And for this event, I am joined by Dr. Renato Oliveira, who is the unit chief. I'm also joined by Dr. Sonja Cafe. She's the regional adolescent health advisor, and by Mr. Macadiel Romero, who is part of the PAHO WHO Youth for Health group. And we want to welcome you to join us for this event as we observe Suicide Prevention Day. As you all know, suicide is a major public health concern for all of us globally, actually. We know that suicides and suicide attempts have a triple effect that impacts not only individuals, but also family, communities, and society. So it is a sad day for some families, a reminder of the loss of loved one, but it's also an opportunity for us to make a difference in people's life. I think this is an opportunity for us to see that each one of us have a role to play in encouraging people to seek help, to take care of themselves, because we know that a lot of people do not seek help due to the social stigma or the lack of awareness on their mental well-being. So thanks for joining us again, and welcome to our webinar. There is a simultaneous translation. There is a recording we'll be able to share with you, and we encourage you to ask your questions. There is a quick Q&A section where you can write your question. There is a chat that you can also write your question. We have translators who will be able to assist us both in English and Spanish, depending on your preference. So without no further ado, I will introduce Renato Oliveira, who is the unit chief, and he will be doing the first presentation for this morning. Renato, over to you.
Thank you very much, Claudina. Hello, colleagues. It's a great pleasure to have you all with us in this very important event and the observation of Suicide Prevention Day. So we wanted to share some of our thinking, but also the actions that we have been doing in the area of suicide prevention, with a specific focus on the area of suicide prevention among adolescents. Let me share my screen with you. And then I'll take you through a presentation that we prepared for this specific event. I believe you all can see my presentation. So as Claudina was mentioning to you, so we are here to celebrate, and we do this every year on or around the 10th of September, which is to celebrate World Suicide Prevention Day. It's an event, it's a date that is organized by the International Association for Suicide Prevention with the endorsement of the World Health Organization. And the purpose of this date is really to focus attention on the importance of suicide prevention as an effort to reduce stigma, raise awareness among different organizations, governments, and the public, and also to pass a very singular message that suicide can be prevented. Before I continue, my colleagues wanted to share some questions with you. So, Claudina, probably you can help us.
Sure, thank you so much. So we wanted to make sure that for this webinar, so we have two questions that we indulge you to please join us. Marta, maybe we can display the question. Question 1. So the first question is, do you know the theme for World Suicide Prevention Day 20, which now it has been extended from 2021 to 2023. So we have a couple of choices there. You only have one choice. One is Our Hope, My Health Matters, Creating Hope Through Action, Together We Can, none of the above. So the voting starts now. It would be good to hear from you. So 7.
Then you let me know, Claudina, when I can continue.
Yes, sure. Please. Okay. I cannot vote, but okay, so we see this is fantastic because 55% of the people who have joined this webinar agree that the theme is creating hope through action. That's the correct answer, and as I mentioned, this run between 2021. I don't know if we'll be able to share the questions with the answers, but it's the first one. So 2021 to 2023. The second question, and this is the reason why we are focusing on adolescent this time. So the second question would be displayed, which says around half of all mental health conditions starts by, and we need you to please select, you only have one choice, select one. Okay, I think we're probably ready to look at the answers. So the majority is saying, I don't know if you're seeing the answers. Let me see if I can, I cannot display. The majority is saying 12, 43% said 12, 10% said 6, and 15% say 16. Only 24% said 14. So the correct answer is 14. And this is very important that we remember that precisely because it's a time when if we are able to provide support, it's good to know when is that the mental health condition start by. So thanks so much for joining us for this poll. Over to you again, Renato.
Thanks, Claudina. We'll come back to you in a few minutes again. Okay, so the World Suicide Prevention Day theme, you have voted. Most of you voted correctly. The theme is creating hope through action. And through this theme, we aim to empower people with confidence to engage with this complex subject many times. We also aim to put people working together through membership and beyond to create a movement working for suicide prevention, but also emphasize the importance of preventative action with sustained messaging to drive behavior change and ultimately to reach our goal, which is to prevent more suicides. Suicide is of a serious regional concern here in the Americas. When we put together data that is submitted by member states, by the countries in our region, we know that almost 100,000 people die by suicide in our region every year. And this is a rate of 9 per 100,000 people. The regional suicide rate, which is in fact a compilation of the data from different countries, has been increasing in the last 20 years. It has increased, in fact, 17%. And some of the countries in our region, in the region of the Americas, they are among the countries with the highest suicide rates globally. It's also important to share with you that almost 80% of suicide deaths in our region occurred among males. The highest rate of suicide in the population is among people aged 85 years and plus. And North America is a region, is a sub-region in the region of the Americas with the highest suicide rate, followed by the English-speaking Caribbean. There are many risk factors that contribute for suicide. There are risk factors that are related to health systems and the barriers that people face when they need to access healthcare because of mental health issues, but also because of suicidal ideation. There are societal barriers, community risk factors, also relationships. So this acting at the population level, but there are also individual risk factors that help us to think about possible areas of intervention to prevent suicide. And some of those are mental health conditions, people who have already a previous suicide attempt, job or financial losses, people with chronic health conditions, including chronic pain, family history. We also know that some genetic and biological factors play a role. And when we come to the specific topic of this session here, which is adolescent mental health and adolescent suicide prevention, as Claudina started to mention to you, adolescence is a crucial period for developing and maintaining social and emotional habits that are important to mental health well-being, that are important for the prevention of mental health conditions, and that are important for the prevention of suicide. So it's very important that adolescents adopt healthy sleep patterns, exercise regularly, develop and strengthen interpersonal relationships, problem solving, coping skills, and that adolescents, they learn to manage emotions. And you will see, I will mention later to you, the importance of learning how to manage emotions as an evidence-based activity to prevent suicide. And again, building healthy relationships within the family, school, and friends is part of promoting good mental health and mental health well-being. Poor adolescent mental health has impact not only in mental and physical health, but in many other areas that influence the life of adolescents. So, for example, we know that adolescents that have poor mental health, that go through mental health conditions, they have lower educational achievement and they have more school dropouts. They engage more in unhealthy risk behaviors. there is more stigma and discrimination, and also human rights abuses against people, and especially adolescents who are going through mental health issues. The well-being of caregivers is also affected when an adolescent is in poor mental health. And that is the topic that we are discussing here. It increases the probability of premature death through suicide or violence. Poor mental health among adolescents also leads to depressive disorders, anxiety disorders, and other behavioral disorders, which are among the leading causes of years lived with disability in adolescents in our region. Poor mental health also leads to the possibility of self-harm, which is the third leading cause of mortality among males and females aged 15 to 19 in the region of the Americas. And we know the reality that most of those mental health needs among adolescents, among young people, are unmet in the region. So there is poor availability of care, and there is poor access to mental health care for adolescents in the region of the Americas, which is also affect globally. It's not only a particularity in our region. Data shows that, and I mentioned that to you, the public health importance of self-harm among males and females aged 15 to 19 being the third leading cause of mortality in that specific age group. Claudina, I think we have more questions to our colleagues here today, right?
We do. Yes, we do. We want to make sure that today's webinar is also interactive, so we give you the opportunity. So we could probably show the other. We have 2 more questions, and that will be the end. So we give you the opportunity to join us in participating in learning a little bit more. I think now you learn about the issue of when is it that it's become more relevant, that we pay attention to mental health conditions. Now we're going to talk about the impact of this pandemic that has had on adolescents in the region. So, you know, these are, you can select what you consider has been the most impact, you know, loss of parents and caregivers due to COVID. You know, as we know, there's many who have been orphaned because of the, you know, the pandemic, disruption to daily routines, large gaps in education and socializing, feeling of isolation, increased exposure to domestic violence, food insecurity, or you think maybe it's all of the above? Okay, so perhaps you have had time to vote and we can see what the majority is saying. Good answer. So we have 63% are saying all of the above. And as you know, it's exactly all of the above. This has been a very difficult time. There was someone in the chat that's saying this is, you know, there is an underreporting of the situation. It's a silent suffering that we're seeing. So it's very important that we continue to understand the impact on adolescents. So we move to the second question, the second and the last one, actually. So the second and the last one, it's important that we're familiar with interventions that are effective based on evidence to be able to address suicide. So are you familiar with the Live Life interventions? And if you're familiar with the Live Life interventions, can you tell us what are the different interventions? So one will be limited access to the means of suicide, interacting with the media for responsible reporting, foster social-emotional life skilling as adolescents, early identify, assess, manage, and follow up of everyone who is affected by suicidal behavior, or all of the above. Which one of these interventions you think is part of the Live Life interventions? You can choose 1 or 3, 1 or 4, or all. Let's hear your answers. Okay, so 66% is fantastic, Renato. We know that a lot of people are very familiar with the Live Life intervention. So if you're familiar with Live Life intervention, we want to encourage you to please use it and or contact us to be able to support you in implementing them. Over to you. 66% of people said all of the above. Some were saying faster social emotional skills in adolescents, but I noticed that the majority was quite correct. Over to you, Renato. Thank you.
Thanks, Claudina. And we are going to give a bit more information and details on Live Life. So I also wanted to show you, as we continue, the changes in the regional suicide rate over time in the last 20 years for people 15, 19 years old. I mentioned to you before that the general regional suicide rate has been increasing, and in this specific age group, it also has been increasing. And in fact, one of the things that worries us is that we see an important increase among females, which is something that we have observed recently with data that is coming from countries. So we need to take this into consideration when designing interventions to prevent suicide. And the pandemic did not help us in terms of suicide and suicide prevention. We know that the pandemic interfered with many important risk factors for suicide. Many people lost family members, loved ones. Many adolescents lost important relatives during the pandemic. Many daily routines have been disrupted. I think the most important one is the fact that people could not go to schools, continue their education, but also interact, socialize, and communicate with peers. So there are important gaps now in education and socializing that we fear could influence suicide now and in the years to come. A lot of feelings of isolation. Also, we know that people staying more at home many times were exposed to increased domestic violence, which is also an important risk factor for mental health conditions and suicide, and also food insecurity. Many parents or caregivers could not work, could not bring the enough resources to the family. So adolescents also suffered because of this specific factor. And this has been shown in a survey that was done by UNICEF, where you can see that adolescents interviewed really described that they have experienced more stress during the pandemic, and even described that they had anxiety and panic attacks. So here, it was really documented the impact of the pandemic on the mental health of youth in the whole region of Latin American and Caribbean, in the countries that were selected for that specific survey. And the topic is so important that it's an indicator in the Sustainable Development Goals inside the target 3.4, which is an agreement by the planet to advance on decreasing suicide mortality globally. So that highlights the importance of the topic and the importance of the commitment of all countries to advance on developing strategies and activities that can reduce suicide. And I also, and you can see that this is also included in the comprehensive mental health action plan of the World Health Organization that has been accepted by all member states in the World Health Assembly. That is, you can see a specific indicator that it's for countries to work towards reducing by 1/3 the suicide rate with a target in 2030. Here in the Americas, in the next coming weeks, countries will meet, ministries of health will meet to discuss the key topics of importance for the region of the Americas. And it's a moment that is also very important for us in mental health, because we are putting forward a new policy for improving mental health in our region. And inside that policy, there are specific elements related to the importance of advancing suicide prevention in the region of the Americas. You can have access to the last version of this policy that is going to be discussed by member states in the PAHO webpage. And Claudina mentioned to you the importance of Live Life. So Live Life is a guidance that has been produced by the World Health Organization that puts together the most updated and the most important evidence-based interventions that can be implemented by countries to be able to advance suicide prevention and reduce number of suicides in the countries. Live Life intervention, in a very brief summary of it, has 7 foundation pillars on how to work to advance suicide prevention. Number 1 is situation analysis, multi-sectoral collaboration, awareness raising, something that we are doing here today, capacity building, financing for suicide prevention, the importance of data, of surveillance, and also monitoring and evaluation going in parallel. So these are foundational pillars to advance suicide prevention in the countries. And together with that, if you go through Live Life guideline, you will see that it promotes 4 key effective evidence-based interventions for suicide prevention. So these are the interventions that we invite countries through technical cooperation to implement at the country level. And we are here at PAHO to support with the implementation of those activities, because we know that those specific activities can be effective. Number 1 is limiting access to the means of suicide. Number 2 is the importance of interacting with the media for responsible reporting of suicide. Number 3, we touched that aspect before, which is the importance of fostering social-emotional life skills in adolescents, especially in the school environment. And number 4 is early identification, assessment, management, and follow-up anyone who is affected by suicidal behavior. So number 4 is really important in terms of having those skills and those capacities in the health system, in the mental health system, to be able to intervene early and provide follow-up and support. At PAHO, we also compile information coming from countries, which we hope can be of help to countries who want to better understand the regional situation in terms of suicide. We have produced a series of reports, and the last one has been released last year with data that goes up to 2019. We also have some initiatives, so that's an area that we work very closely with countries, and we help countries to develop national suicide prevention strategies and plans, so they have a roadmap of activities to be implemented. We also work with countries developing their capacities, especially at the primary healthcare level, on suicide prevention. We have been also working on programs that increase the knowledge of teachers, children and adolescents at schools, and on literacy about mental health, so they learn and they know more about mental health. We also have been working with countries, especially on training and capacity building to journalists on responsible media reporting on suicide, being this a very important evidence-based activity to prevent suicide. And we also have activities strengthening data and surveillance on suicide. And here you have the example of some of those activities, like a course that we have on preventing self-harm and suicide, the MH gap for capacity building of primary healthcare workers on the management of priority mental health conditions that includes suicide and suicide management. And also NLACE is a database that we have online and with data from the different countries in the last 20 years. Currently, we are also scaling up those activities. So we are in the middle of a campaign against stigma, for stigma reduction. The campaign is called Do Your Share. We also, at the moment, the director of PAHO has created a high-level commission on mental health and COVID-19 with different authorities from the region of the Americas discussing which recommendations are important to be given to PAHO and member states on how to improve mental health in the Americas. We also have created a digital specialist on alcohol, being the use of alcohol also an important risk factor for suicide. And there are also other activities that we do with partners like UNICEF, UNDP, and also we are at the moment organizing a conference on suicide prevention together with our partners at the National Institute of Mental Health here in the US. So this is what I wanted to share with you. Thank you very much for your attention. Let me also kindly ask you that you promote those activities, that you share this information as much as you can, so we can move together towards a very big movement to advance suicide prevention in the Americas. Thank you very much, and back to you, Claudina.
Thanks so much, Renato. Very informative, very practical, good information that you're sharing. We are joined by over, I want to say, 413 devices, because sometimes we have more than 2 or 3 persons in one device. I know that because when we send the presentation sometimes and the recording, then that's how we know that there's multiple persons that have joined the event. We are also streamlined through YouTube, so it's good for you to know that. We have, since we are talking about suicide and prevention and what do we know about this impact of suicide on adolescents in the Americans, it's very important that we also take time to understand what has been the impact of the pandemic on adolescent development and well-being. And we would not have been able to do this webinar if we don't consider the importance of having the partnership with our colleague, Dr. Sonja Cafe, who is the adolescent health advisor working with PAHO. And it has been a great pleasure to work with you, Sonja. The work that you do with adolescents is really amazing. Thanks for joining us. Thanks for being with us. And the mic is yours.
Thank you so much, Claudina, and I really thank you for the invitation to collaborate. I should say, also from our side, it's a pleasure to collaborate and a necessity, for our adolescents. And I congratulate you on the organization of this important event with so many participants, which again underlines the importance of this topic. I will share my screen and then go through, oopsie. I hope everybody can see. My slides are in Spanish, but with your permission, I will be presenting in English. So I will elaborate a little bit on some of the elements already touched on in the presentation from Renato. When we speak about the impact of the COVID-19 pandemic, which is still very much alive, because sometimes we feel like we have put this behind us, but unfortunately that is not the case. I will touch on 3 issues. the impact of COVID-19 on essential developmental processes during adolescence, and also the reduction in availability of health services. And then I will touch again also on the whole issue of long COVID. So to understand the impact of the pandemic, we need to, on adolescents, we need to first recognize the developmental processes that take place during adolescence. And adolescence, or the second decade of life, is one of the most changeable and dynamic periods of life, because there's so many critical changes that take place and development. First of all, of course, we have the biological changes that express themselves through puberty, but we also have neurological changes, cognitive changes, emotional changes, social changes that take place all at the same time. And some have more an emphasis on the first half of the second decade, or what we call early adolescence. Others focus more on the second half of the second decade of life, but they are all interrelated. And when one is disturbed, the others, it impacts on the others as well. And when one is disturbed, we really, when it's disturbed in a very significant way, then we know that it increases the risk for health problems, including mental health problems, that can have an impact throughout a person's life course. And I think Renato also already mentioned this, that in this vital stage of life, this second decade of life, these profound changes, biological, cognitive, emotional, and social changes, require a supportive environment. Because an adolescent cannot develop in isolation. This is why UNICEF and others advocate to not put young children in prison, because the social environment is so critical for the healthy development of an adolescent. And that social environment includes the family, it includes the school, it includes the community. And I think, again, Renato already mentioned that through these developmental processes, young people progressively take responsibility for their own behaviors, including their health behaviors. So this is a critical opportunity to foster healthy life skills and to foster healthy life practices that will carry them throughout adolescence as well. Now, what has happened during the COVID-19 pandemic is that not only the biological presence of a disease that was so scary, many people didn't know what it was, what it would do with us, but also the social and environmental changes that took place to try and protect us from COVID really made the social life of a young person very narrow, very small. We can speak about the confinement measures that were necessary, what we call physical distancing, the school closing, and also the lack of interaction with peers that is so important during adolescence, because as you know, in the psychology, we see how the importance of the nuclear family moves to a wider environment, and especially the importance of peer interactions during adolescence takes on a very significant role. And so the impact of the confinement and the chronic stress that was created due to unknown lack of knowledge, lack of understanding, loss of family members, some of the things that Renato also mentioned, really has a substantial effect on the developmental processes of adolescents. The emerging data indicates that it has an effect on neurological development, on brain development, it has an effect on the ability to develop relationships. It has an effect on cognitive development. The studies that are now coming out show that in some environments, 1 to 2 years of school closures has had such an important impact on the cognitive abilities of young people beyond 2 years. Some scientists are now even theorizing that these two, and we're in the 3rd year now of the pandemic, that this phase might have a similar impact as what we call adverse childhood experiences, or ACE, which is the impact of the accumulation of trauma and toxic stress. We really don't know yet what this effect really is, but we do know that it's not good, and that it does impact on the mental health of our adolescents. What is important always to keep in mind is when we speak about adolescents, they're not all the same, because we have young people in conditions of vulnerability who have had an even more traumatic impact experience. I'm here you can see some, but there's more. Young people living with disabilities, migrants, living in poverty, LGBTQ young people who already had a disadvantage. The impact of isolation and loss of social context is more severe when we speak about certain young people. And so when we try to interfere, we need to make sure that we also take into account what is happening with our young people in conditions of vulnerability. The other issue that I was going to highlight is the impact of the loss of access to health services. Pre-pandemic, access for young people to health services was not ideal. We were working very hard to increase access to quality and comprehensive health services, including mental health services. But we know that the pandemic has had a disastrous impact. I'm here seeing some slides on surveys that were done. The one on my left shows the results of the pulse surveys done by the World Health Organization, and on my right shows the results of a project called ISLAC, of surveys done in our region, in Latin America and the Caribbean. And they show that there was really an interruption of access to health services that can help our young people, that can support early diagnosis, prevention, etc. And so in the recovery phase, it will be very important for all of us to try and not only recuperate, but to accelerate access for young people to quality health services, including and in particular mental health services. And then the third issue that we don't talk about enough is the issue of long COVID. Some of us refer to it as post-COVID condition. Again, the knowledge is emerging, but what we do know is that long COVID has an effect, and it can be in months, in years, and many young people who have had COVID, maybe very low-level infection, also tend to suffer from post-COVID condition that can have an effect of neurological decline, trouble sleeping, trouble functioning, chronic tiredness. And if we are not aware of that and capture that and try to provide services for these young people, they are even more isolated because they don't know what's happening and why they feel so bad. And so the post-COVID condition is something that we all really need to take into account in our recovery efforts and interventions. So what can we do? and I think I have 5 more minutes. There are 5 things that I would like to highlight. Some of them were already mentioned by Renato in his presentation. First of all, we need to make sure that we promote and support healthy psychosocial development for our young people in a modus that is recovery, no? And that is repair of the damage that was done through the COVID-19 pandemic. We need to address their mental health as a priority issue. We need to guarantee their access to health services, to essential health services. We need also to manage the use of social media that has such an important impact on the lives of our adolescents. And I just want to mention that social media can have a very positive effect if we use it in a constructive way to reach our young people, to breach the gaps in access, but it can also be have a very destructive impact when we think about the fake news, the over accumulation of messages that they are exposed to. And then finally, we need to ensure that young people are part of the solution. We need to involve our young people. They have solutions, they have thoughts, they have innovation. They can help us to accelerate again the progress in recovery. And I will close here, and I thank you again for your attention, and thank you for the opportunity to participate. Over to you, Claudina.
Thank you so much, Sonja. Definitely very insightful, very useful, and again here very practical information and guidance that you're providing. And of course, you know, the importance of involving our youth. And we cannot do this without them. We need to learn to, to listen and to engage and to have them to participate. There's this famous word, which are not my words, that says nothing about us without us. Am I saying it correctly? Nada sobre nosotros y nosotros, or nothing
Yes.
about
nothing for us without us.
Nothing for us without us. And with that, thank you so much, Sonja. And with that, I want to invite Magdiel Romero. Magdiel Romero is part of the Bajo Youth for Health group, which, as I mentioned, is coordinated by Sonja, and we have all from Bajo have joined this effort of being part of that. I think the gender gap here is so important. I mentioned before, we know that when we talk about suicide, there is 3.5 male suicide for every 1 female. So, but then, you know, it's the opposite when we think about suicide attempts. And so we have more male dying by suicide than female, but we have more female dying by, attempting suicide. So the gender gap is important. And more important is that when we talk about suicide prevention, it requires not only an institutional changes, but also, as it was mentioned by Sonja, the importance of individual self-empowerment and message of optimism. And this is what Makadil is going to bring to us, this message of optimism. Thank you for joining us. And the mic is yours, Makadil. You're muted, but I'm sure you'll be able to unmute your mic. Yes.
Thank you. I will speak loud. No me encuentro en casa. Pues muchas gracias por la invitación, por el espacio. Y pues como lo dijeron, voy a hablar acerca de el suicidio, experiencias personales. Y bueno, primero, antes que nada, quiero decir que en 5 años de experiencia como profesional de la salud, he tenido muchas experiencias con el suicidio. En mi trabajo soy paramédico y además he trabajado en la línea de de emergencias. Y pues esto me ha brindado pues muchas experiencias, ¿no? Pero de la que quiero hablar hoy es, creo yo, de la que más conozco y de la que más cercana tuve, que pues es la personal, ¿no? Como joven que soy, muchas veces enfrentamos problemas diversos a lo largo de toda nuestra etapa de jóvenes y más también como adolescentes. Y pues bueno, en este caso no soy la excepción a muchos jóvenes y adolescentes. Y bueno, pues quiero contar esta experiencia. Es complicado porque no la he ensayado, no la he contado a casi nadie y es la primera vez que lo voy a contar, ¿no? Sobre todo frente a cámaras y demás. Pero bueno, siempre tuve esta cercanía con el suicidio. He visto suicidios frente a mí, he visto intentos de suicidio, he tratado de apoyar en intentos de suicidio y pues todo esto me dio una experiencia personal pues bastante amplia. Pero como lo he dicho, siempre la más importante es la personal. Entonces, pues me gustaría contarles que hace más o menos 5 años, 5 o 6 años, en una situación complicada porque pues al salir de la universidad, creer que ya no tienes como muchas alternativas, sobre todo cuando se tienen altas expectativas, cuando la sociedad y las personas que te rodean generan o crean en ti altas expectativas y no las cumples, pues sientes que estás defraudando a alguien. Me dice que la conexión es inestable, espero que mejore pronto. Eh, y no llenar estas expectativas, encuentras un rumbo, como dirían, el sentido de la vida. No sabes ya cuál es el sentido de la vida y empiezas a cuestionarte muchas cosas. Y alguna vez en ese momento de depresión, que fueron 2 años, de una depresión difícil y que además es difícil pues mostrarla, ¿no? Sobre todo yo y muchas personas consideran que soy una persona bastante alegre, bastante sonriente y que siempre ve el lado bueno de la vida. Y entonces es mucho más difícil, ¿no? Tal vez algunas personas que me conocen y me están viendo probablemente creen que la persona más lejana a eso sería yo por cómo veo la vida, pero la realidad es que pues estuvo muy cerca. ¿Qué tan cerca? Pues como lo dije, soy profesional de la salud y al estar aislado de mi familia, de mis amigos, en otro lugar diferente a mi casa, un poco lejos, pues fue donde se me ocurrió esta idea, ¿no? Que anteriormente ya me había preguntado muchas veces cómo sería morir, cómo sería perder la vida, pero jamás había tenido como, digamos, la oportunidad o el momento. Y al ser profesional de la salud y tener acceso a medicamentos que son medicamentos controlados y sobre todo al tener pues mucha experiencia sobre suicidios que me tocó ver o intentos de suicidio, sabía como cuál era el camino que debía de seguir en ese momento. Entonces, pues con los medicamentos controlados y demás, los abrí, cargué la jeringa y todo, pero al final hubo algo ahí que me detuvo, que hasta la fecha no puedo decir qué es, pero lo que sí puedo decir es que en ese momento decidí que era importante cambiar las cosas. Y eso fue un sábado en la noche. La primera decisión que hice al día siguiente, a pesar de que era domingo y es difícil, fue contactar a un profesional de la salud mental y esa fue la primera decisión que tomé y afortunadamente tomé la decisión correcta. Profesional de la salud hasta la fecha ha sido mi psicóloga y que ya me dio de alta y que ahora puedo agradecerle bastante y que por cierto a veces es muy complicado compartir estas experiencias. Ella, a pesar de que me atendió y que pudo apoyarme bastante y cambiar mi perspectiva de muchas cosas, ella no sabe esto que estoy contando. Tal vez algún día ya se lo pueda compartir. También lo tuve que compartir en un momento muy personal donde una persona quería estar estaba en esa situación, en un intento de suicidio y me costó bastante, pero al final creo que la causa fue valiosa. Y pues hoy les puedo decir que con el apoyo psicológico, con la atención psicológica y sobre todo el acercamiento a la salud mental, pues es muy diferente. Ahora pues me encuentro mucho más lejos de lo que estaba antes y en mi cabeza pues eso ya no existe, ¿no? Pero debo decir que es difícil y es duro tratar de enfrentarlo. Les digo qué tan cerca estuve de eso, pues a 2 centímetros y a presionar 5 milímetros. Y pues en ese momento, estando solo, lo más seguro es que ya no hubiera tenido la oportunidad de estar aquí compartiendo esta experiencia, que como les digo es dura y es una experiencia personal que me costaba mucho trabajo compartir. Ahora lo comparto, creo que vale bastante la pena que puedan escuchar esto, sobre todo porque pues muchas veces no vemos las señales que se presentan o no conocemos del contexto de las demás personas y creemos que pues muchas personas están lejos de hacer esto. Sin embargo, siempre es importante cuidar nuestra salud mental y si podemos cuidar la salud mental de las personas a quienes estimamos e incluso hacer actos de heroísmo y cuidar de la salud mental de las personas que ni siquiera conocemos. Nuestros valores nos instan a preocuparnos por todas aquellas personas que pueden estar en un momento difícil y saber que esa es una pues, decisión complicada, pero que no es la mejor decisión que podemos tomar. Siempre hay algo más y pues el mensaje es más de que la esperanza pues siempre puede venir. Hoy lo que parecía haber perdido en ese momento está llegando a mi vida y se retoman muchas cosas. Entonces me gustaría compartirles ese mensaje que muchas veces es difícil. El proceso hay momentos oscuros y lo importante es la salud mental, las herramientas para poder enfrentarlo y saber que nunca estamos solos en estos procesos, en estas etapas. Entonces, eso es lo que quisiera compartir. Ahora, el día de hoy, apoyo bastante, me interesa mucho la salud mental, no tanto por la experiencia personal, eso es algo que comparto porque pues ahora ya me nace compartirlo. Lo hago porque creo que es importante, porque como ya mencionaron las y los expertos anteriormente, es un problema que cada vez tiene mayor presencia, sobre todo en las y los jóvenes. Y pues muchas gracias por escuchar mi historia.
A ti las gracias. Profundamente agradecidos desde nuestra unidad, desde la OPS, porque estamos no solamente la unidad de salud mental, sino que la unidad de adolescentes, Adolescent Health. Mira, profundamente agradecidos porque este es un acto heroico, el hecho que puedas compartir con nosotros y que también porque tú eres un profesional de la salud. Así que estamos sumamente agradecidos que hayas tomado este momento. Muchísimas gracias, Magdalena. Son experiencias que lo que queremos es inspirar, apoyar y dar la oportunidad a las personas que siempre vale la pena retroceder. Y es lo que tú nos has enseñado, la importancia de tomar el tiempo de retroceder, de reflexionar y no actuar en un momento que podía ser un momento difícil para ti, pero que todavía tuviste la oportunidad de salir adelante. Y por eso te tenemos ahora nosotros acá, ¿no? Nadie quiere ir a un funeral, nosotros queremos estar en lugares donde podamos celebrar el uno al otro. Así que te celebramos y te damos las gracias por acompañarnos y por darnos estas palabras inspiradoras de la importancia de seguir acompañando a las personas. No es lo mismo escuchar a bueno, tú eres un profesional de la salud, pero no es lo mismo escuchar a un profesional de la salud que no sepa lo que es caminar caminar en los zapatos de las personas que saben lo que es sufrir, porque generalmente el sufrimiento emocional es silencioso. Muchísimas gracias por tu participación y esto nos lleva a la última presentación que tiene mucho que ver, esta presentación tiene mucho que ver con el estigma, ¿no? Yo voy a compartir mi pantalla. Ups, creo que estoy compartiendo la pantalla. Quiero compartir esta pantalla, la 1. No sé si la pueden ver.
Todavía no, Claudia.
Todavía no. Ok, let me try again. Lo que voy a hacer ahora es hablarles a ustedes sobre, hablarles sobre la campaña, precisamente esta campaña que se trata de, del estigma, de la reducción del estigma. So it's Mental Health Stigma Reduction Campaign. I'm going to switch to English now. So the campaign is the Mental Health Stigma Reduction Campaign. We are planning to launch this campaign on October 10th, but we want to let you know about this campaign because it's similar to what we're doing now. Do your share to support to promote mental health. So why it is so important to talk about stigma and discrimination? Because as you all know, when there is a stigma that excludes the person from the rest, and clearly that attitude of discrimination, that decision of discriminating person, doesn't help the person to be able to want to seek help because they feel like they're ashamed of what they're going to do. So as we know, why do we have to address mental health stigma? And because we also know that it's been said that the stigma can be more damaging than the illness itself. So the impact that has on the individual. Therefore, it becomes so relevant for us to make sure that we work in reducing discrimination, in promoting mental health, in having that conversation, because the stigma has so many stereotypes, and because of the stigma, people sometimes they have so many barriers to be able to access help. So the theme of our campaign is Do You Share? And we have this Do You Share in the theme. We have it in Spanish as tu parte. We have it in Portuguese, in French, in Creole, and we are also planning to have it in Dutch. So these are all the languages that we'll be having this campaign to Do Your Share. When you visit our PAHO webpage, you will see all these materials there about doing your share because to be able to support mental health. A couple of the activities that we have is what we call is the Benches Initiative. And this is a bench. Some of the countries are now engaging with us to have this green bench where they will be placed in public spaces. Some countries are planning to have them in their schools. And the idea here is to continue to promote Do Your Share to support, promote mental health. We also want to take the opportunity to, because as we know, the way how we speak about, the way how we talk sometimes can be very creating, not purposely, but sometimes without even knowing it, that we can be creating more discomfort on people, creating, stigmatizing them. We talk about failed or unsuccessful suicide attempt, and this is not it's not about failure, it's about the pain that persons are going through. We just heard about the importance of the emotional pain, all the factors that go for a person to want to attempt suicide. So the respectful way of talking is attempt suicide. The respectful way, we don't use the word committed. People commit crimes, but when it comes to dying by suicide, people die by suicide. I don't intend to read everything. You'll find that in our website in terms of what language is more respectful. And of course, we encourage you to please follow us on the Facebook, Instagram, Twitter, LinkedIn, talking about the suicide prevention. As you know, the idea here is for us to continue working on the importance of promoting and decreasing the rates of suicide in our region. So follow us on the campaign on social media. We definitely want to encourage you to do your share. And this is the web page there for our PAHO website. And I want to end by asking you to please do your share to support, to promote mental health. With that, thank you so much for joining us. This brings us to the end of today's webinar. We will be, if you register, we'll be sharing with you the link to the recording and to the presentation. I want to thank all our presenters and of course our people who are joining us to the interpreters. Thank you so much for being with us. And thanks also to our colleagues from communication to have this event live. I think it's over to you, Renato, and colleagues who were with us.
Thanks, Claudina. This was a great event. I saw that at some point we had 500 people, so it's really great that you joined us. I hope you can also disseminate, as I mentioned, some of those activities in your countries, in your workplace. Please reach us if we need any help. And it will be great to have the opportunity to see all of you again. Thank you so much. Good weekend to all of you.
Thank you so much for everyone, and have a good weekend and stay safe. We should do a picture. Do we still have a